If you have a book, if you have the book pala, you can browse it. You can turn to page 100, 475 kasi I'm patterning the flow of my lecture to the pages in the book, no? Okay, so
Again po, Doc?
if you have the
What?
book, no, page 475, if you have the book, you can browse it, you can listen to me, and you can browse it kasi the flow of my lecture is patterned to the pagkasunod-sunod ng mga pages, no? So you can read while I'm doing my lecture also. Okay, so the entire blood supply of the brain and the spinal cord depends on two sets of branches, no? So two pairs: vertebral arteries arising from the subclavian arteries, and the internal carotid arteries, which are branches of the common carotid arteries. So this is a representative image, no? Okay, for your orientation again. This is your aortic arch. It gives off three branches, no? This is the brachiocephalic vein, the common carotid, the left common carotid, sorry, and the left subclavian vein. Now, arising from the brachiocephalic vein, we have your right common carotid and the right vertebral. Your left common carotid arises from the arch of the aorta itself, while your left vertebral artery arises from the left subclavian vein. Okay, so this is just to orient you from areas that it goes off. Now, the vertebral arteries arising from the subclavian, no, and the internal carotid arteries, which are branches of the common carotid arteries on both sides. Okay. Now, the brain receives about 15% of the resting cardiac output and 25% of the body's oxygen consumption. Now, if for some instance, no, there is obstruction, no, into the supply to the flow to the brain. If there's ischemia, the most common cause of ischemia is when there is a heart attack or cardiac arrest, which causes ischemia to the brain. 10 seconds of brain ischemia will lead to unconsciousness. Okay, 20 seconds will lead to loss of electrical activities of the brain, and after 3 to 4 minutes, there's irreversible brain damage. Okay, so remember these times. Okay, excuse me. The arterial supply, the arterial blood reaches the brain through the pair of, as I mentioned earlier, no, the pair of arteries, the pair of internal carotid, which supplies 80% of the telencephalon and the diencephalon, which is the forebrain, and the vertebral arteries, which supplies 20% of the brain blood supply to the brain, which gives off branches to the brainstem and the cerebellum, along with some smaller cortical regions. Now, let's start with the internal carotid artery. It arises from the common carotid, no, on both sides, at approximately the level of the fourth cervical vertebra, or C4. The common carotid splits into two: the internal carotid and the external carotid. You can see here in this image, the larger one, follow my arrow, is the external carotid artery, no? And the smaller one is the internal carotid artery. It's partly hidden, no? The internal carotid takes a deeper, no, more internal path, eventually traveling up into the skull to supply the brain. The external carotid travels more closely to the surface, so it's more superficial, no, and sends off numerous branches to the neck and to the face. Okay, so these are the two branches. Now the ICA goes up and enters the skull through the foramen lacerum, foramen lacerum, and it goes to the canal called the carotid canal. So this is the picture. This hole here, you can see my arrow, is the foramen lacerum. This canal here is the carotid canal, and then the internal carotid eventually ends up in the cavernous sinus. Okay, cavernous sinus. Now this is the hole for the foramen magnum where the vertebral artery enters. We will discuss that later. Now, cavernous sinuses, we discussed this already before. I listened to the lecture of Dr. Gasco. No? Okay, for a review, a sinus or a venous sinus is part of a branching complex networks that lies between the layers of the dura. No, the dura is the outermost covering of the brain, and it functions to collect oxygen depleted blood. So it's a venous structure. No, venous sinus is a venous structure. The sinuses receive blood from the veins of the brain and drain ultimately to the internal jugular vein. Okay, remember the internal jugular vein. We will encounter that later again. Now, the cavernous sinus is one of those venous sinuses. It is a paired structure that's located within the cranial cavity. The cavernous sinus, if you can see this image, it cavernous, meaning there are many compartments within. The blue stuff is the blue structure, the blue stuff within is the venous blood. So hindi lang sa venous blood, may mga structures, we have nerves as well, and the internal carotid artery which passes through it. No, now for an important tidbit or nice to know, the cavernous sinus is the only site in the body where an artery at the internal carotid artery actually passes completely through a venous structure. No, so yeah, this is an importance of the cavernous sinus. Okay, another nice to know, we have there the ophthalmic nerve. Okay, we have also ophthalmic vein there, no, beside it. No? The ophthalmic vein connects with the facial vein to the face. No, it's not here. It's not in your book. This is just nice to know. The ophthalmic vein connects with the facial vein to the face. Now, the facial vein drains the areas near your nose, no, the center of your nose. So where there's infection there, may da kali the pimple na infected or may da samad, no, may sugat ka dyan, this can gain entry to your facial vein and then connect to your ophthalmic vein and then eventually drain into the cavernous sinus, which will put, there's infection in the cavernous sinus, which it will lead to cavernous thrombosis. Okay, may develop mga pus na, so nagkakaroon ng thrombosis in this area. This is just nice to know. Okay, are we okay so far? Okay lang?
Yes po, Doc.
Now, the internal carotid arteries form two major cerebral arteries. So actually, there are 6 branches of the internal carotid arteries. No, yeah, and we have 2 terminal larger arteries. We named the anterior cerebral and the middle cerebral artery. No? Now, the internal cerebral artery, or the ICA, as it leaves the cavernous sinus, as I mentioned earlier, it gives off a branch called the ophthalmic artery. No, before bifurcating into its terminal branches, the anterior and middle cerebral arteries. Other branches include the anterior choroidal and the posterior communicating artery, and a smaller branch named the hypophyseal artery, which supplies the pituitary. No? Now, the anterior choroidal supplies the choroid plexus of the interior horn of the lateral ventricle. You already had your lecture before of your CSF production and CSF flow. Tama? Your choroid plexus is the one that produces CSF. No? So your anterior choroidal from your ICA actually supplies blood to your choroid plexus in this area. Now we have the middle cerebral artery, which carries 30% of the carotid blood. So look at this picture again. We have your vertebral artery, your vascular artery. We have here your anterior choroidal artery, and your middle cerebral artery. Okay, this is the largest branch of your internal carotid. Okay, you will encounter this picture a lot more later. First branch, ophthalmic artery, enters the orbit through the optic canal. It supplies the eye and the orbital structures, and its terminal branches supply the frontal area of the skull, the ethmoid, and the frontal sinuses, and the dorsum of the nose. Next branch is the anterior choroidal artery, which enters the inferior horn of the lateral ventricle and supplying its choroid plexus. Next is the posterior communicating artery. It joins the internal carotid artery, or the ICA, with the posterior cerebral artery. So this is an important part of the circle of Willis, which I will discuss later on. Next is the anterior cerebral artery. It is the smaller of the 2 terminal branches. No, it runs superior to the optic nerve and enters the great longitudinal fissure. The longitudinal fissure is the midline space, the fissure in between 2 cerebral hemispheres. No, the space in between. You see my arrow. That's the great longitudinal fissure. Now, you have an anterior cerebral artery on one side and anterior cerebral artery on the other side. No? So there are 2 branches, and it is joined in the midline by the anterior communicating artery. Okay, if you see the circle, this is one side, this is one side. This small artery is the anterior communicating artery. Okay, it joins the 2 ACAs of both sides. Now, the anterior cerebral artery curves backward. If this is a sagittal cut, which we see the medial surface of the brain, the anterior cerebral artery, follow this arrow, these 2, curves backward over the corpus callosum. This is your corpus callosum. This is your anterior cerebral artery, and then joins with the posterior cerebral artery on the posterior side. Okay, so actually the ACA joins with the PCA. Now, the territories supplied by this artery include the motor and sensory cortex for the lower limb alone. Okay, we will discuss it further later. Next is the middle cerebral artery. It's the largest of the three cerebral arteries. It passes to the lateral cerebral fissure, seen in this area. No, you can see this fissure readily when you see a brain structure. It is also known as a Sylvian fissure. Now, it's divided into 4 segments. Now, for your information, no, all the cerebral arteries, the anterior cerebral, the posterior cerebral, and the middle cerebral arteries are divided into 4 segments. No, we have the M1, M2, M3, M4. For the anterior cerebral, we have A1 to A4, and the posterior cerebral, we have P1 to P4. I chose to discuss the segments of the middle cerebral artery. These are actually the segments where more common areas, more common areas where thrombus or emboli are lodged, no, in this area. So the middle cerebral artery is divided into 4 segments. We have the horizontal segment, which gives off the lenticular striate arteries or smaller branches, which are perforating branches or penetrating branches. No? We have the insular segment, M2. We have the opercular segment, and we have the cortical segments, M4, which causes the lateral convexity of the cerebral hemispheres. No? So M1, M2, M3, M4. Okay. So lenticular striate arteries, we will encounter this later also. Next, we go to the vertebral arteries. We are done with the internal carotid arteries now. The vertebral arteries are a branch of the first part of the subclavian artery. It ascends the neck through the transverse processes of the upper 6 vertebral bodies, no? Upper 6 cervical vertebrae, no? May space dyan sa transverse process nila, then papasok ang vertebral arteries, no? And then it entered the skull, as I mentioned earlier. It entered the skull through the foramen magnum, and it actually passes medial to the medulla oblongata. And at the lower border of the pons, it joins with the vertebral artery of the opposite side to form the basilar artery. So the lower border of the pons is the important marker to where the basilar artery is formed. Okay, lower border of the pons. Now, the vertebral artery has 5 major branches before it becomes the basilar artery. No? We have anterior spinal artery, posterior spinal artery, which are arteries that supply mainly the spinal cord. We have the posterior inferior cerebellar artery, which is the largest branch of the vertebral artery. And as the name implies, it supplies the posterior inferior surface of the cerebellum. Then we have the meningeal arteries, which supplies the dura mater of the posterior cranial fossa. And finally, we have medullary arteries, which supply the medulla oblongata. Okay, so these are your vertebral arteries, no? Paired. Okay, joins at the lower border of the pons, okay, to form the basilar artery, no? Now, this is the anterior spinal artery, posterior inferior cerebellar artery. Okay, so far. Next is there. Next is the basilar artery, no? At the lower border of the pons, again, the 2 vertebral arteries join to form the basilar artery. Now, the basilar artery arises at the midline groove of the pons, anterior groove of the pons, no? This midline big structure here is the basilar artery. No? It has 5 major branches as well. First are the pontine or the pontine arteries, which supply the pons. Okay. Next is the anterior inferior cerebellar arteries and the superior cerebellar arteries, which, as the name implies, supplies the anterior inferior segment of the cerebellum and the superior segment of the cerebellum. Okay. Next is the labyrinthine arteries, which supplies the internal ear. So occlusion of this branch can lead to vertigo and ipsilateral deafness. And finally, we have the posterior cerebral artery, which is a terminal branch of the basilar artery, which is paired on both sides, formed at the upper border of the pons. So at the end of the pons, the basilar artery becomes the posterior cerebral artery on both sides. Okay, can you follow me so far? Are you following? Hello? Hello?
Yes.
Yes po, Doc.
All right. Now, if you see in your book, the 3 major cerebral arteries, no? The posterior, the middle, and the anterior cerebral arteries have three branching patterns, no? May three branching patterns sila. First are the cortical branches of all the three arteries, no, or the three cerebral arteries. These cortical branches supply the outer portion of the cerebrum, the surface of the cerebrum, or the outer portion of the cerebrum. Next are central or perforating branches, which actually, as the name implies, penetrate, okay, to the deeper portions of the brain. This, for example, is this image, no, as I showed earlier. This is the image of the middle cerebral artery, and it's penetrating or perforating branches called the lateral striate arteries, no, which supply the internal capsule and the caudate nucleus at the innermost portion of the brain. Okay, its obstruction are called lacunar infarcts. And finally, we have smaller choroidal arteries, which supply the choroid plexus of the ventricle. So these are the three branching patterns of the cerebral arteries. Now, for cortical branches, for the anterior cerebral artery, you have this picture in your book. It's in page 478. For the blue one, this is the anterior cerebral artery. The cortical branches supply the medial surface. Okay, this is the medial surface. It supplies the medial surface of the cerebral cortex as far back as the parieto-occipital sulcus. So this is the medial cortex. This is the parieto-occipital sulcus, which divides the parietal lobe to the occipital lobe. Okay, this is the demarcation, and a strip of the cortex about 2.5 cm at the lateral surface. So let me just show you very quick. Yeah, this is the lateral surface. The blue one is supplied by the anterior cerebral artery. No? So this part at the lateral surface and most of the medial surface is supplied by anterior cerebral artery. No? And the more important structures supplied by the anterior cerebral artery are the motor and sensory areas to the leg, no? To the lower extremities. No? For the medial surface, this small area, this is the temporal lobe. This distal temporal pole is supplied by the middle cerebral artery, the pink, and the rest of the temporal lobe and the occipital lobe is supplied to the posterior cerebral artery on the medial surface. This is the branching. This is the supply. Now, for the middle cerebral artery, it supplies the entire lateral surface for the motor area of the hemisphere, except for the narrow 2.5 cm, as I mentioned earlier, the narrow 2.5 cm strip supplied by the ACA, the blue one, and the inferior lateral surface, okay, inferior lateral surface, and the occipital pole, which is supplied by the posterior cerebral artery. No? So most of the lateral surface is supplied by the middle cerebral artery. Now, the posterior cerebral artery supplies most naman of the inferolateral, so the inferior. So for the ACA, it's medial surface, MCA, lateral surface, PCA, inferior surface. No? Inferolateral surface and medial surfaces of the temporal lobe, and the lateral and medial surfaces of the occipital lobe. Now, the more important structure that's supplied by the PCA is the visual cortex, no, which is located in the occipital lobe. Okay, this is just a representation of the inferior surface. No, you can see that most of the inferior surface is supplied the posterior cerebral artery, the pink one. Most of the inferior surface except the temporal pole. Now, the middle cerebral artery supplies the temporal pole and the lateral aspect of the orbital surface, and the anterior cerebral artery supplies the medial aspect of the orbital surface of the frontal lobe. Okay, so yeah. Now, these are just representations of important structures, no, that are supplied by these great cerebral arteries on the lateral surface. We have the primary motor and the first somesthetic or somatosensory area. The superior area supplies the leg, no, while the rest of the motor supply of the body is supplied by the middle cerebral artery, including the Broca's expressive speech area, the primary auditory area, and the vernix receptive language area. Now, as I mentioned earlier, the tip of the primary visual area is supplied by the posterior cerebral artery. Okay, so study this image first. Next are the choroidal arteries, as I mentioned earlier. We have two major choroidal arteries. The anterior choroidal artery, which is a direct branch of the internal carotid and supplies the choroid plexus of the inferior horn of the lateral ventricle. Again, the choroid plexus is responsible for the primary production of your CSF. Next is the posterior choroidal artery, which is a branch of the posterior cerebral artery, which supplies the choroid plexus of your third ventricle and lateral ventricle. Now, for specific areas of the brain, we have your corpus striatum and internal capsule, which are the innermost parts of the brain. It's mainly supplied by the medial and lateral striate central branches of the middle cerebral artery. Those are yung pinakita ko kanina, the perforating or penetrating branches of the MCA. Also, ACA gives off some branches to these areas as well. No? Now, the thalamus is supplied by the branches of the PCOM A or posterior communicating artery, basilar artery, and posterior cerebral artery. The midbrain is supplied by branches of the PCA, superior cerebellar artery, and basilar artery. The pons is supplied by the basilar artery and the anterior, inferior, and superior cerebellar arteries. The medulla oblongata is supplied by the vertebral artery, basilar artery, and posterior spinal arteries, and posterior inferior cerebellar arteries. Okay, so these are specific areas of the brain supplied by these arteries. Now, for the cerebellum, we have three major blood supply. The anterior, we have the superior cerebellar artery and the anterior inferior cerebellar artery, which are branches of the vertebral artery. Okay, and the posterior inferior cerebellar artery, or the PICA, which is a branch of the basilar artery. Okay, superior, anterior, and posterior. No? The first two are branches of your vertebral. The last is a branch of your basilar artery. Okay, these are the major branches of your cerebellum. Now, nerve supply. Nerve supply of the cerebral arteries are sympathetic postganglionic nerve fibers derived from the superior cervical sympathetic ganglion. Now, stimulation of these nerves causes vasoconstriction of the arteries. And under normal conditions, the blood flow is mainly controlled by concentrations of carbon dioxide, hydrogen, and oxygen present in the nervous tissues. Now, a rise in the carbon dioxide and hydrogen and a lowering of the oxygen tension in these nervous tissues can bring about vasodilation of these arteries. Okay? Now, for venous drainage, the veins of the brain are thin-walled, no? They have no muscular layer, they have no valves, and it doesn't necessarily follow the arterial pattern of the brain, no? Now, we have brains for the cerebrum, the cerebellum, and the brainstem. Now, for the veins to the cerebrum, we have the external and the internal veins. No, the external cerebral veins, there are four. No, we have superior cerebral, middle cerebral, and inferior cerebral veins, and other smaller veins. No, see this picture first. We have here your superior cerebral vein, okay, which passes over the lateral surface of the cerebral hemisphere. No. Actually supplies the upper 2.3 cm of the lateral surface, no, the superior cerebral veins, no, and eventually drains into the superior sagittal sinus. Okay, superior cerebral veins drain into superior sagittal sinus. Next, we have the middle cerebral vein. The middle cerebral vein is divided into the superficial and deep. No, the superficial cerebral vein drains the lateral surface of most of the lateral surface of the brain. Okay, and it runs inferiorly within the lateral sulcus, together with the middle cerebral artery. If you remember earlier, di ba? Diyan din dumadaan ang middle cerebral artery, and it drains into the cavernous sinus. Okay, so superior cerebral vein, sagittal sinus, superficial part of middle cerebral vein, cavernous sinus. On the deep middle cerebral vein is deep, as the name implies, is medyo deep in location, no, adusan sa loob. Okay. Deep middle cerebral vein drains the insula, okay, and is joined by the anterior cerebral vein. Okay, this is your deep cerebral vein here, anterior cerebral vein, and some striate veins to form the basal vein. Okay, remember the name, basal vein. No? or the basal vein of Rosenthal. Remember the name. Basal vein of Rosenthal. We have two internal cerebral veins, no? Okay, these are two internal cerebral veins are formed in the midline, at the lateral, at the midline, at the area of the third ventricle, formed by the union of septal, thalamus striate, and choroidal veins. Okay, so these internal cerebral veins. Okay, here. These paired internal cerebral veins at the midline, at the area of the third ventricle. Okay, when it reaches the splenium of the corpus callosum, this is your corpus callosum. When it reaches the area of the splenium of your corpus callosum, both sides join. Okay, they join to form the great cerebral vein. Okay, the great cerebral vein or great cerebral vein of Galen or Galen. Okay, and the great cerebral vein of Galen is formed by two internal cerebral veins. Okay. Now, remember the basal vein earlier, the basal vein of Rosenthal. This is the spelling Rosenthal. Okay. It actually joins the great cerebral vein, okay, and then drains into the straight sinus. Okay. Also, as mentioned earlier, the previous lecture by Dr. Gasco, no, we have here your confluence of sinuses. It was mentioned before. I was listening. It is formed by the drainage from the superior sagittal sinus above, the straight sinus, and the occipital sinus. Okay, they form the confluence of sinus, which drains into the transverse sinus, and then eventually drains into the internal jugular vein, as I mentioned in my earlier slides. No? So these are the venous drainage of the veins. No? Inferior image, we have the deep middle cerebral vein, together with the anterior cerebral vein, form the basal vein of Rosenthal. Okay? Which joins the great cerebral vein of Galen. Okay. Again, these are the images of the inferior cerebral veins on the lateral aspect of the cerebral hemisphere. Okay, clear so far? Again, veins of the midbrain and cerebellum. Okay, this is your cerebellum. This is your midbrain. They join the great cerebral vein of Galen. This great cerebral vein of Galen, because it's proximal to it, so they drain into the great cerebral vein of Galen. Okay? The cerebellum and the brainstem. Now, for the pons and the medulla, they drain into nearby adjacent venous structures as well. Now, let's go to the arteries. We're done with our blood supply to the brain. The arteries, we have three. No, one unpaired anterior spinal artery, two posterior spinal arteries, and radicular segmental arteries. Okay. The anterior spinal artery is formed by the union of two arteries, each of which arise from the vertebral artery of the skull. So this is a single Y-shaped artery, no? Y-shaped artery, two arteries which join at the midline to make a Y-shape, no? It supplies the cord of at the cervical level, supplies the anterior 2/3 of the cord, no? So branches from the anterior spinal artery enter the substance of the cords and supplies the anterior 2/3 of the cord at the cervical level, cervical spine. We have your posterior spinal artery, which are paired, arising from the vertebral artery or the posterior inferior cerebellar artery. No? So the posterior spinal artery may arise from the vertebral artery or may also arise from the posterior inferior cerebellar artery, which in turn is a branch of the vertebral artery. Now, it enters the cord also at the cervical level and supplies the posterior 1/3 of the cord. Now, these spinal arteries are numerous or are large at the cervical spinal level. No? Okay. But however, these spinal arteries are insufficient and become smaller as it goes down, specifically at the thoracic level. No? So these spinal arteries are insufficient to supply the cord alone beyond the cervical level. No? So then lalabas ang ating radicular or segmental spinal arteries. So these are small arteries, longitudinally running and posterior and anterior spinal arteries, no, arising from the arteries outside of the vertebral column. No, they reinforce the posterior and anterior spinal arteries below the cervical level. No? So they arise from the deep cervical, ascending cervical, intercostal arteries, and lumbar arteries. These are the areas where radicular or segmental spinal arteries arise. No? Now, when it enters the vertebral foramina, it divides into two, the anterior and posterior radicular arteries. Okay? But these radicular arteries do not necessarily anastomose with the anterior and posterior spinal arteries as well itself. No? So they do not necessarily anastomose. Another additional feeder or branching arteries that help supply the lower two-thirds of the spine are the medullary arteries. No? The largest of which is named the Great Anterior Medullary Artery of Adamkiewicz. This is especially important because this could be the major blood supply. Sometimes it becomes the major blood supply of the spinal cord of the lower half or the lower two-thirds of the spinal cord. No? So remember this artery. So this is just a representation. This is the posterior spinal artery, smaller, supplying the posterior one-third of the spinal cord, and the anterior spinal artery, which supplies the anterior two-thirds of the spinal cord. Okay? So yun. Now, radicular and medullary feeder arteries are potential vulnerable segments because if for some reasons, no, these radicular and medullary arteries are compromised, no, or if there are pathologic disease entities in their specific areas, no, its occlusion can cause muscle weakness and paralysis to the area it supplies, no, to the specific area it supplies, because nga, the anterior and the anterior and posterior spinal arteries are insufficient in supplying the lower spinal cord below the cervical spine, no. So pag may nangyari dito sa radicular and medullary feeder arteries, it can cause muscle weakness, okay, and paralysis because the spinal arteries are insufficient to supply the cord below the cervical spine. Okay, klaro tayo dyan? The veins of the spinal cord. No, venous drainage is supplied by 6 longitudinal tortuous vessels, no, 3 anterior and 3 posterior spinal veins. Okay, these spinal veins drain into the internal and external vertebral plexuses. Now, only the internal vertebral plexus may go up to the brain to connect with the dural venous sinuses superiorly. Okay, so the internal vertebral plexus empties into the dural venous sinus superiorly. Okay. Now the circle of Willis, I mentioned it already earlier. Circle of Willis lies around the interpeduncular fossa at the inferior aspect of the brain. This is your circle of Willis over here. Okay. Now, the circle of Willis is a part of the cerebral circulation and is composed of the following arteries. Okay, let me show you, ha. This image is in your book, and this follow lang. The anterior cerebral arteries, paired, okay, connected by the anterior communicating artery. Okay, we have the posterior cerebral arteries here, okay, and the posterior communicating arteries, which connects the posterior cerebral artery with the internal carotid artery. Okay, so yun. Anterior cerebral artery, left and right. Anterior communicating artery, which connects both the right and the left anterior cerebral arteries. The right and left anterior internal carotid artery. The posterior cerebral artery, left and right, and the posterior communicating artery, which connects the left internal carotid to the left posterior cerebral artery, and the right internal carotid to the right internal posterior cerebral artery. No, so ito yung circle na ginagawa nila. No, oddly enough, no, the largest branch, the middle cerebral artery, is not considered part of the circle of Willis. So hindi siya kasama sa circle of Willis. Now, functional significance, no. The circle of Willis equalizes blood flow to different parts of the brain. No? It allows blood that enters either the internal carotid artery or the vertebral arteries to be distributed to any part of both cerebral hemispheres. You can see this. You can see this picture. Okay, and in your book, I think it's in page, what's this, 481, you can see this picture. No? This is just a representation showing that there's little interchange of blood across the right and left half due to equal pressures between the arteries. No? So there is no interchange of blood. Now, in case of the occlusion of the arteries distal to this collateral segment or collateral channel, proximal to this collateral channel, the circle of Willis acts as a principal collateral channel, no? In case of occlusion. Now, I will just discuss two more common abnormalities or pathologies of the blood supply to the brain. No, first is a stroke. Next is the aneurysm. Now, the stroke is a term as an acute development of neurologic deficits due to disturbance of blood supply to the brain. Four main causes of stroke or cerebrovascular accident, CVA, cerebrovascular accident, are the following: thrombosis due to obstruction of a vessel by a locally forming clot, or clot that forms within the cerebral vessels. No. Next is embolism, is due to obstruction of a vessel by an emboli or embolus formed elsewhere, formed from the heart, from the leg, no, that goes up to the cerebral arteries. Next is hypoperfusion, where there is during shock or during acute blood loss, no, you have a low BP, your brain is hypoperfused, no. And finally, when there's hemorrhage due to accumulation of blood within the cranial cavity, such as in ruptured aneurysm. Most common cause among the four is an atherosclerotic embolus, usually arising from the vessels in the neck, no? From your carotid vessels. An embolus forms and it lodges in the vessels in your brain. Now, obstruction or occlusion of the three major cerebral arteries will lead to first let me just show you the image first. This is your anterior cerebral artery, no? This is your anterior cerebral artery. Can you follow my arrow, everyone? Hello? Okay, this is your anterior cerebral artery. This is your anterior communicating artery. Now, if the thrombus or if the embolus is lodged in this area, before the anterior communicating artery, the blood supply in this part can actually help in supplying this part that is supplied by this artery, no? So this artery supplies this part, no? Kung ma-block siya, the blood vessel here, because of the anterior communicating artery, the blood here can help perfuse this area, no? So there is minimal or less or no deficit involved. However, if the thrombus is lodged in this area, no, distal to the communicating arteries, no, then na magkakaproblema kasi there is no more collaterals here, no. So ma-obstruct na talaga. It's occluded. The anterior cerebral artery becomes occluded and produces these symptoms: contralateral hemiparesis and hemianesthesia, mainly of the leg and the foot. Diba? I showed you the picture. Because of the involvement of the upper part of the primary motor and primary sensory areas, no? Diba? The upper part, diba? Upper 2.5 centimeters of the lateral hemisphere supplies the lower part of the leg and the foot. Next is inability to identify objects correctly due to involvement of the superior parietal lobule. Next is apathy and personality changes due to involvement of the frontal lobe. Now, medial cerebral artery, because this is not part of the circle of Willis, no? So it doesn't benefit with the collateral of the circle of Willis. Therefore, its occlusion can lead to contralateral hemiplegia and hemianesthesia of mainly the face and the arms, no? Due to involvement of most of the primary motor and sensory areas at the lateral surface of the brain. Next is aphasia or loss of speech if the dominant hemisphere is involved. And finally, we have contralateral homonymous hemianopsia, okay, because of the involvement of the optic radiation. Finally, with the occlusion of posterior cerebral arteries, it may lead to contralateral homonymous hemianopsia because of the involvement of the visual cortex at the distal end of the occipital lobe. However, some degree of macular sparing because the occipital pole is also an alternative supply from the middle cerebral artery. Okay. In your book, it says also there is impairment of memory because of involvement of the temporal lobe if the posterior cerebral artery is occluded. Okay. Okay. So next, most common pathology in the brain in the cerebral arteries is the intracerebral aneurysms, which is a dilatation of an artery greater than 50% of its normal caliber. This most likely occurs in the vessels contributing to the circle of Willis. So this mostly happens in patients who are hypertensive. Hypertension causes weakening of the vessels, of the vessels in the area around or contributing to the circle of Willis. Because of hypertension, this area is weakened. Coupled with production or formation of atheroma in this area, and these vessels become larger. Some of these vessels may produce mild symptoms, because of the mass effect. When the vessels become larger, it intrudes on the adjacent nervous structures. May mild symptoms then. Although sometimes no symptoms are seen until they rupture. Now, when they rupture, you see subarachnoid hemorrhage on CT scan. Once it ruptures, this becomes a medical emergency already, and the patient is likely to die unless treated swiftly. So, treatment is more often than not surgical for intracerebral aneurysms. Okay, so I think this is my last slide. It's up to 5 o'clock. Thank you, everyone. Any questions? Hello? Hello? Hello?
Hello, Doc.
Hello, yun. Okay na. Okay na po. That's my last slide. Paano ba ito palaki? There you go. Yun na. Ano ba? Okay, any more questions?
None so far, Doc.
None so far. Ano ba to? Paano po nun? Anyway, there are no more questions. That's it for today, no? Have a nice day, everyone. Thank you for listening.
Thank you,
Bye-bye.
Doc.
Thank you, Doc.
Thank you.
Thank you, Doc.